Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor. Thank you for joining us.
Hey, good morning.
Let me ask you about, we had talked about the post-Thanksgiving surge. Are we seeing that now? Do you expect that more next week? And will that happen again at Christmas?
Yes, we're just starting to see it now. We just started seeing a few people come in positive who had gathered at Thanksgiving. Remember how this whole thing plays out. It takes, a week to get it, a week to get sick, a week to get really sick. So it should be happening more as hospitalization rates and everything are going up, most likely also along with this. And we'll see the same thing at Christmas if everybody congregates again at Christmas.
Interesting story out of South Korea where the coronavirus has pretty much been eradicated or under control anyway, about a person being in a restaurant. There was no COVID anywhere near, and they got infected by someone 20 feet away.
Yeah, no, it's a fascinating story. I'm glad you brought it up because what they use cell phones and GPS tracking there. And then they did experiments with the airflow in an enclosed room, which was a restaurant. And they found that people 20 feet away could get infected if they were facing the flow of the air, whereas those had their back to the airflow did not get it. It's really incredible epidemiologic detective work.
What's your assessment of Indiana, which is not good, but Illinois is not good either? So, and they seem to be a little bit more open than we are. So what's the difference?
Well, the difference is that Indiana and Wisconsin are doing much worse than Illinois. Illinois is at least sort of making a sincere attempt at getting this thing down. Not doing so well, but it going in the right direction, where Indiana is #2 per capita in the United States. They had too long, and even now, with what's going on, they've canceled elective surgery, which is good because the hospitals are getting full. And they have a mandated mask order, which a lot of people don't follow, but that can happen anywhere. But they've reduced the group gathering size to 25 or 50, depending on where they are. I mean, that's ridiculous. I mean, there should be no group gathering in Indiana at this particular point.
Let's get to some viewer questions. This person says, explain a little about what happens in your blood after receiving one of these mRNA vaccines.
Yeah, no, this is a great question. The picture that you had up there, those red things coming off the virus are what they call the spike protein. And that thing helps get the virus into the cell. And so what Pfizer and BioNTech, their partner, and Moderna and the NIH have done is they've made a synthetic version of that protein, that spike protein. So you get the injection, the body thinks it's a coronavirus. It thinks it's the real thing. And so it builds all these antibodies and immunologic responses to fight that, so that when you do get infected with the real virus, it attacks those spike things immediately, and it can't enter into the body. Works quite well, apparently.
All right, next question. I have been hearing that this vaccine only offers protection for 3 to 4 months. Is that true?
No, that's not true. That's probably because that's as much data as they have. So it's partially true. We don't know. But the early reports of the patients who got the vaccine at the beginning in the phase 1 and 2 studies looked like that the immunity, in other words, the body's ability to fight the virus, actually does last more than a couple months. And so we're just guessing as to how long. But this is a huge question because, if it really goes away, you're going to have multiple doses of these vaccines. But right now, we're just watching very closely, and we don't think that's going to be the case, at least in the first year.
Next question. They just announced that there is no drinking for 6 months in Russia after receiving the vaccine. Why is this?
Well, the Russians, they like to drink a lot. And it's actually 2 months. I looked this up because I was a little bit surprised when I saw that story myself. So what they're saying is they want people to not drink for 2 weeks before the vaccine and then 6 weeks after they take it because, alcohol is an immunosuppressant if you drink too much of it. So they want to just play it safe. Of course, the inventor of the vaccine himself said, "Oh, you could have a glass of champagne." I think everything in moderation, including moderation. But it probably is a good idea, but it kind of came out of nowhere. But in Russia, they're very heavy drinkers in Russia, statistically. So I think perhaps it's a good idea, but I mean it just kind of came out of nowhere.
All right, Dr. Murphy, thanks for being with us. You can post a question for the doctor on our Morning News Facebook page. We'll talk to him again tomorrow at this time. Thanks so much.